And we'll be talking a little bit about this. The government has in the last few hours ruled out any Ebola case in Kenya. Now, tests conducted on a woman who had been suspected of carrying the deadly virus returned negative. And the case had put Kericho and the country at large on the edge following 2 deaths in Uganda from the highly contagious haemorrhagic fever. And as Enoch Sikolia reports, the government has stepped up surveillance at entry points to keep the virus at bay.
After a day full of anxiety, the Ebola scare has been scientifically quashed. Blood samples from the 36-year-old woman who had been isolated at the Kericho Referral Hospital after showing Ebola-like symptoms, finally testing negative to the Ebola virus.
In conclusion, we wish to state that the patient is free of Ebola and other haemorrhagic fevers.
Technicians at the Kenya Medical Research Institute in Kisumu City spent the better part of the day testing blood drawn from the patient. The scare coming at the time the Democratic Republic of Congo is struggling to control the Ebola outbreak that has killed 1,400 people and which has jumped borders to the neighboring Uganda, where 2 deaths have been reported in the last few days. The patient, a business lady at the Malaba border point, had visited her spouse, a businessman in Kericho town. 3 other family members, including her husband, have also been under observation.
But as a county, we remain vigilant for any suspected cases.
While visiting the Jomo Kenyatta International Airport, JKIA, on Monday, Health CS Cecily Kariuki downplayed Ebola threat reports.
In DRC today, we have 1,300 people who have already died out of Ebola. It means, therefore, if we use the word Ebola and it's likely being around, it's going to cause untold panic for no good reason. So let's confirm every story before we air it. Let's be careful how we package the information that gets out.
The CS maintains that measures have been put in place to ensure Ebola virus disease is kept at bay. At the JKIA on Monday, port health officers inspected everyone coming into the country. First, visitors or Kenyans coming back home are to fill an Ebola virus disease traveler surveillance form that requires one to indicate the country of origin and if or not they have experienced symptoms classified as Ebola-like. But worth noting is a section asking travelers to indicate if they had traveled to DR Congo in the last 21 days, which is the incubation period for Ebola. One is also expected to indicate the exact towns, sub-counties and counties of DRC he or she visited. Ebola outbreak has hit hard eastern Congo regions like Kivu. Everyone coming into the country has to go through here. Now, this is the place where the airport has mounted thermal guns and thermal scanners to ensure that whoever goes beyond here is Ebola free.
Good afternoon.
Now, like this traveler here, if the thermal scanner detects that your body temperature is way above 37 degrees, you are temporarily detained for further analysis.
Your temperature is high.
For her case, she was able to prove that she had fever and was under medication. That enabled her pass after a few minutes. Cecily Kariuki says even though prevention measures have been put in place, the government is prepared to respond should an Ebola case emerge.
It will be remembered that Kenya contributed to fighting Ebola in Liberia some years back by getting some of our HR attached in Liberia. They have since come back and they have joined my team in the ministry, and we have therefore redeployed them to the ports of entry to support the local team.
Enoch Sikolia, Citizen TV.